Welcome student on another video lecture. Today's topic is liposome. Liposomes are bilayer vesicular carrier system of phospholipid or cholesterol. Their size ranges from 25 to 2.5 nm. Liposomes are advantageous due to their ability to encapsulate various materials and their structural versatility. They can encapsulate drugs having varying solubility or lipophilicity. They can have one, several or multiple concentric membranes. They are made up of polar lipids having a lipophilic and hydrophilic group on the same molecule. The polar lipids on interaction with water self-assemble and form self-organized colloidal particles. Liposome cross-section shows that the hydrophilic head of amphiphile orient towards the water compartment and the lipophilic tail orients away from the water-soluble compound get entrapped in water compartment and lipid-soluble compound aggregate in lipid section. Now, properties. They can encapsulate hydrophilic as well as lipophilic material. They can enhance product performance by increasing ingredient solubility, improving ingredient bioavailability, enhancing intracellular uptake, and altering pharmacokinetics and biodistribution. Liposomes made up of natural lipids are biodegradable, biologically inactive, non-immunogenic, and exhibit limited intrinsic toxicity. Liposomes made up of phospholipid can be used to change the pharmacokinetic profiles of drugs, herbs, vitamins, and enzymes. Now, advantages. They provide selective passive targeting to tumor tissue. They increase the efficacy and therapeutic index. They increase drug stability by encapsulation. They decrease the toxicity of encapsulated drugs. They improve pharmacokinetic effects, reduce elimination, and increase circulation lifetime. They provide flexibility to couple with site-specific ligands to achieve active targeting. They are biodegradable and flexible. They can carry water as well as lipid-soluble drugs. So these are the advantages of liposome. Now, there are different types of liposomes. First one is unilamellar liposome, small unilamellar vesicle and large unilamellar vesicle. Second type is multilamellar liposome and third type is other specialized type of liposome, sheath liposome, cationic liposome, pH sensitive liposome. So these are the unilamellar liposome, in that small unilamellar vesicle and large unilamellar vesicle. You can see here, this one is the aqueous core or aqueous drug material, and these are the bilayer phospholipid layer in case of unilamellar liposome, and there are multi phospholipid layer in case of multilamellar liposome. This is the structure of multilamellar liposome. These are the phospholipid layer, and aqueous drug is incorporated inside the in that phospholipid layer. This one is cationic liposome. This is cationic lipid. This one is neutral lipid. This one is ligand. These are the antibodies. And pegylated lipid. This is the structure of cationic liposome. Now this one is the Schildt liposome. In that these are the drug molecules which are incorporated by the phospholipid layer. It is surrounded by the phospholipid layer. And these are the PEG polymer brush. This is the structure of Schildt liposome. Now pH sensitive liposome. This is the structure. This one is the blood pH and switch on to tumor pH and switch off to blood pH. So this type of liposome inside the tumor pH, and this one is the liposome at blood pH. So it is the pH sensitive liposome. Now method of liposome preparation. There are 4 basic stages in all methods of liposome preparation. First step is drying down lipids from organic solvent. So drying of lipid is done from organic solvent. Second one is dispersing the lipid in aqueous media. Now that lipids are dispersed in aqueous media, purifying the resultant liposome. The liposomes are produced and that resultant liposomes are purified. Analyzing the final product. So these are the 4 basic steps in all methods of liposome preparation. There are 2 basic techniques for liposome preparation. First one is passive loading technique and second one is active loading technique. That passive loading technique involves 3 different methods such as mechanical dispersion method, solvent dispersion method and detergent removal method. Now this one is the classification of methods of liposome preparation. Passive loading technique, active loading technique. Passive loading technique, in that mechanical dispersion method, in that first one is lipid film hydration by hand shaking, non-hand shaking or freeze drying, microemulsification, sonication, French pressure cell, membrane extrusion, dried reconstituted vesicle, freeze thawed liposome. In case of solvent dispersion method, ethanol injection, ether injection, double emulsion reverse phase, evaporation vesicle, stable plurilamellar vesicle. Detergent removal method, in that detergent, cholate alkyl glycoside, triton X100 remove from mixed micelle by dialysis, column chromatography, dilution, reconstituted Sendai virus envelope. So these are the different methods by which liposomes can be prepared. Now mechanical dispersion method. To prepare the liposome by mechanical dispersion method, it is done by lipid film hydration. The lipid must first dissolve and mixed in organic solvent to assure a homogeneous mixture of lipid. So lipids are dissolved in organic solvent so that a homogeneous mixture is produced. Now that organic solvent which are used are chloroform or chloroform methanol mixture are removed. Once the lipid are thoroughly mixed in organic solvent, the solvent is removed to yield a lipid film. Now for removal of the volume of organic solvent, dry nitrogen is used in small quantity or small volume, and for large volume rotary evaporator is used so that all the organic solvent should be removed. Now the lipid film is thoroughly dried to remove residual organic solvent by placing the vial or flask on vacuum pump overnight. Now it is dried by placing it on vacuum pump. Lipid solution frozen by placing the container on block of dry ice or swirling the container in dry acetone or alcohol. After that, disruption of large multilamellar vesicle suspension using sonic energy, that is sonication, typically produce small unilamellar vesicle with diameter in range of 15 to 50 nm. Sonication of large multilamellar vesicle dispersion is accomplished by placing a test tube containing the suspension in bath sonicator or placing the tip of sonicator in a test tube and sonicating for 5 to 10 minutes. Solvent dispersion method. In case of solvent dispersion method, a solution of lipid dissolved in diethyl ether or ether methanol mixture is slowly injected to aqueous solution of material which is to be encapsulated at 55 to 60 degrees Celsius under reduced pressure. So the lipid solution that is dissolved in diethyl ether or ether methanol mixture, and the mixture is slowly injected to aqueous solution of material which is to be encapsulated. The subsequent removal of ether under vacuum leads to formation of liposomes. Thus the liposomes are produced. Subsequent removal of ether under vacuum leads to formation of liposome. The main drawback is population is heterogeneous, that size ranges from 70 to 190 nm. This one is the drawback of that method. Next one is ethanol injection method. A lipid solution of ethanol is rapidly injected to a vast excess of buffer. The multilamellar vesicles are immediately formed. So in case of ether injection method, the lipid or the methanol mixture is slowly injected, whereas in case of ethanol injection method, it is rapidly injected to a buffer and multilamellar vesicles are immediately formed. But the drawback of that method are the population is heterogeneous, that is 30 to 110 nm size. Liposomes are very dilute and it is difficult to remove all ethanol because it forms azeotrope with water, and the possibility of various biologically active macromolecules to inactivation in presence of even low amount of ethanol. Azeotrope mixture means the mixture where the two liquids they will boil at same temperature, so the vapors of both the liquids are produced. So for that reason it was difficult, and sometimes inactivation is also caused in low amount of ethanol. Now detergent removal method. The detergents at their critical micelle concentration have been used to solubilize lipid. As the detergent is removed, the micelles become progressively richer in phospholipid and finally combine to form large unilamellar vesicle. The detergent can be removed by dialysis method, and excellent reproducibility and production of liposome population which are homogeneous in size. So here the liposomes which are prepared, they are homogeneous in size. The main drawback of this method is retention of traces of detergent within the liposome, but some traces of detergent are retained in case of liposome in this method. Here there are some example of liposomes which are prepared from herbal drugs. Quercetin liposome, active ingredient in quercetin. Application: reduce dose and enhance penetration in blood-brain barrier. Biological activities that includes antioxidant and anti-cancer. Method of preparation is reverse evaporation method is used, and the administration route is transnasal route. Second one is liposome artemisia arborescens. Artemisia arborescens essential oil is the ingredient. It enhances the penetration in cytoplasmic barrier. Used is antiviral, and film method and sonication is used for preparation of liposome. In vitro method. Paclitaxel liposome. Paclitaxel high entrapment efficiency and pH sensitive. Anti-cancer, it is the use. Thin film hydration and in vitro method is used for administration. Curcumin liposome. Curcumin is the active ingredient. Long circulating and high entrapment efficiency. Biological activities: anti-cancer. Preparation method is ethanol injection method is used, and administration route is in vitro. Some lipid-free liposomes are also reported depending on the amphiphilic nature of drug with both hydrophilic and hydrophobic groups. For example, hydrophilic resveratrol was conjugated to hydrophobic norcanthridine, a derivative of canthridine. The resveratrol and norcanthridine liposomes were prepared by ethanol solution injection and sonication method, and then spontaneously transformed to tadpole-like structure after 24 hours due to small hydrophobic moiety and bulky non-canthridine moiety. This formulation not only improve the drug encapsulation but also increase the toxicity in zebrafish embryos compared with free monomer. This strategy helped to deliver natural products by combining hydrophilic and lipophilic molecules also. So in this way, targeted liposomes are prepared and they are giving more efficient effect or better therapeutic index as compared to conventional dosage form. And many herbal drugs, they are having marked pharmacological action but poor solubility and poor bioavailability. These are the drawbacks of these phytoconstituent, and when such targeted liposomes are prepared from the drugs, naturally they will give more pharmacological action and therapeutic index as compared to conventional dosage form. So this is about the liposome, a detailed account of liposome. Thank you.